Alright, I wanted to put together a quick PowerPoint kind of walkthrough, summary pages to kind of help all those struggling with the daunting task of both diagnosing and treating mold toxicity. So, really basic. This is for people who suspect mold and have need help navigating that diagnosis and understanding if they're what they have to do in order to diagnose it and then how to treat it. So, signs and symptoms. First of all, it's likely that if I'm sending this to you, we've already discussed signs and symptoms of mold. However, for all those who haven't had any signs or symptoms addressed, here are your major signs and symptoms. The keynotes are very specific to mold. Now, that doesn't mean that they're only mold related, but they're very highly likely mold related. So those electrical shock like pains, vibrating sensations, those are really unique central nervous system, nervous based symptoms. Extreme fatigue, even more than just infection, but dragging out of bed consistently over weeks to months to years. Poor medication tolerance. Basically, the body doesn't tolerate any additional toxicities, whether that's chemical, whether that's light, whether that's sound, whether that's even like scented candles can be a trigger. But medication in particular, even if it's supplements, they just don't process things well. Heart rate changes, so blood flow regulations, getting up from a seated position, like we said, light sensitivity. The body's kind of already very stimulated by the amount of toxicity that's being exposed. Excessive thirst. Your body's trying to detox, trying to get rid of everything. And then generally, you're going to have a lot of downstream effects. So read through the list. Those aren't very specific to mold, but they usually do come up with mold symptoms or mold exposure. And this is more environmental toxicity than it is an ingestion of mold. So not as much food related, but much more in the environment and the toxins that you're being exposed to. And so a lot of it is both ingestion, inhalation, and the actual absorption of the toxicities. So if any of these are signs or symptoms for you, if a lot of them are, you need to proceed with additional testing in the next steps, which we'll talk about. So here's a very famous pathway that was really kind of popularized by Shoemaker, who I believe is the one who came up with it. And if you look at it, I don't know if you can see my cursor, but the bottom, let's see, I think I can do this, yeah. So if you look this way through the biotoxin pathway, this is the ideal avenue where your body kind of just discards it. However, if you're being exposed, it can go in multiple different pathways. The top one here is more of your immune system and reacting to that. So you see cytokines, which is your inflammatory response, causing immune system symptoms, increased activation of platelets and immune function cells. And then also you see going down this way, affecting the central nervous system, affecting the hormones associated and the neurotransmitters associated. And then you also have this pathway here, which is a direct insult to the nervous system. And so you see sleep disturbances, chronic pain, a lot of effects systemically in the body, where this is people who come and present with fibromyalgias or weird symptom complaints that aren't really being addressed in other ways because they're not being evaluated for mold toxicity. So here's a kind of a famous pathway, which really doesn't pertain to most of my patients. It's more for clinicians and people who are evaluating for mold. Alright, so etiology and cause. So this is actually really important for patients to understand because this is where you can find your mold or find your exposures. So where is it found? Usually in houses built before the 1930s because they are pretty much old at this point. There's some decay, there's probably some leaks, some water damage, whatever it is. Now, also houses built after the 70s. So a lot of my patients say, I have a new house. Well, great, but new houses are built with cheap materials because they're built quickly, and not necessarily cheap, but materials that mold likes to grow on. So a lot of organic materials, all that sheetrock and things like that, they really harbor mold growth. And then two, they're better sealed, which means there's more chance for humidity and poor ventilation, so things don't dry out as easily. So if there was some type of leak or water damage, it's likely to create more of a downstream problem than a house that's in the 30s or 40s or 50s that have more ventilation than we do in the newer houses. And that's efficiency purposes, but it kind of is unfortunate with the mold exposures that we get now. Large old buildings, schools, and offices, it's just due to poor water damage and things over the years. Basements and attics, that's where you want to look most of the time. They're darker, they're less regulated, there's more water damage, especially HVAC systems in the attic. And then other places that are less common but are sometimes places to look would be front-loading washing machines. They don't drain very well, so it's common to see that. And if you're rewashing your clothes and mold, you can have some exposures. And then CPAP machines, make sure that you're cleaning those out regularly. So what to look for? Constant poor smells, musty smells, water damage smells. Look for signs of water damage or water staining. And then also look for if there's mold growth on cardboard boxes, or if your produce is fermenting and degrading faster than normal kind of out in your environment. That's mold attacking and binding to those substrates for it to grow on. And so sometimes that can be a hint moving forward of where to look. So what are the three things that mold must have? Humidity has to be above 60%, so warm, humid climates. And that could just mean the air is trapped in your environment. Dark locations between walls, very common. Can't see it, but it's growing there, and it will affect you because it will grow outside of the walls and will grow into the place where that toxins are transmitted through the wall. And then organic material we talked about. It doesn't grow on stone. It doesn't grow on concrete. It must grow on something organic. Wood, sheetrock, even dust can harbor it too because it's technically organic materials. So those are the three musts. So what do you do if you have the symptoms? You have maybe known exposure. How do you screen yourself? Visual contrast sensitivity online. So it's an easy, cheap test to do using your computer or your phone. You can do a contrast sensitivity testing your eyesight, and that is affected commonly with mold exposure. Number two, I send my patients home with a questionnaire to see if they have the likelihood of the symptoms. So it's kind of a way for us to gauge our responsiveness to the symptoms or our quantity of symptoms associated. And number three, you can get blood work done. Chronic inflammatory response syndrome labs. This isn't a perfect way to test because there's very specific labs that need to be done at certain locations, and it can get complicated and it can get costly, and it doesn't actually diagnose you with the mold toxicity. It just indicates that the markers for inflammatory responses of mold are elevated or diminished or likely. So it's kind of an additional screening, but it's not perfect for mold toxicity. It's not directly associated. So that's the way you test, you screen yourself. So I always have my patients screen before moving on to additional testing, because testing can get complicated, it can get costly, it can be time consuming. So we start with the screenings. So once we screen the patient, we also screen the environment at the same time, and that I usually do with some simple mold plates. So basically you can get these mold plates at local hardware stores, you can get them online, you can get them, I carry them in my office, and you basically just put them out in the environment according to these instructions. Here's a link to where I get mine, and then they can indicate without diagnosis that there is a likelihood of mold in the environment depending upon how many spores come back on a plate. And so the more spores, the more likelihood of mold. Now, most places will have some. It's normal to have some mold, but it's not normal to have excessive amounts, and that's where toxicity starts to play a factor. Now, the ERMI, E-R-M-I, is a secondary screening that you can utilize as well. That's a more accurate, more specific, more costly test that can be done, and that's going to be more accurate to do. I usually start with the mold plates if there's a lot of symptoms, if there's mold plates positive, if your screening VCS and questionnaire are positive. Then I don't always say that the ERMI is required. It might be just good to move on to the next step, but some people want additional confirmation, and ERMI is a place to do that. So that's a swab in the house you can do for your house or environment to see if there's mold exposure there. So here's the company that I use, but there's a lot of companies that you can get it from. Mycotoxin testing. So here's the next step. So patient testing is different than patient screening. Testing will tell us exactly, with better accuracy, how much toxin is in our system. So you can do an organic acid test. That's a basic one, and it's something that I would do to indicate toxicity. It's not going to tell you your volume, your types of toxicity, but it will tell you that you likely have a toxicity based upon what's coming out in your urine. We can test for it. It also has some other markers which are good, like GI markers, nutrient markers, things like that. So it's kind of a more broad spectrum, less specific test. Now, your gold standard, in my mind, is your mycotoxin testing, and that's very specific to just mycotoxin exposure. Those are 3 labs that I use: the Vibrant Wellness, the Great Plains, and the Real Time. Each one is got pros and cons to which company or which lab to use. There are some doctors in the space who will use all 3 at once because they each tell you something different, but each one I think would work sufficiently individually. And I usually do provoke that detox strategy. So glutathione, sauna, or sweating stimulates the body to start draining some of the toxins which are accumulating in the system, so that when we do take the sample, it is more accurate. So something we discussed prior to testing, making sure that your body is pushing some toxins out, so that when we do collect the urine, we will have an accurate sample. The problem with it is that sometimes the body's not in a great detox place, and it takes some months to get the body detoxing. And so if you repeat lab testing, it's common to see actually the levels go up after a period of time, and that's a good sign. Your body's draining things, but it kind of can scare people through the process. Getting worse, but sometimes it's actually a good sign. The only downside to this is it is out of pocket, so you're going to pay a couple $100s to do these tests, but it is the best standard of testing. So what can we do in addition, depending upon the symptoms? We can do nasal swabs. A lot of times you get respiratory tract infections, respiratory symptoms, so you can do a mark-on nasal swab to look for what's growing in the nasal passages as we inhale all that mold. GI stool testing, I look for infections in the gut after all the ingestion of the mold. And then you also can do other things like neuroquant MRIs to see what kind of inflammatory triggers are actually manifesting in the brain, and that will light up in different ways, showing those different pathways we talked about before in regards to these inflammatory cascades. All this is additional testing that's telling you more information about how the mold is affecting the patient and manifesting. So what do we do for environmental testing? So we screened, now we test. The testing really is get an inspector in there, or a contractor, or someone who is trained to look and find mold, and they actually have to look and find mold. A lot of times the industry is not very standardized, and you'll get someone to come in and they'll do a quick air sample and grab it and leave, and it's completely inaccurate. You need someone to, and they can do air samples, that's fine. I don't love it. That's the standard usually for most people. They'll come in a little device and they'll do an air sample in various locations, but I find it to be very inaccurate and fluctuates. And so I actually want them to come in and look behind walls. They drill little holes so they can look behind walls and to see where there's humidity. They have different gauges. They can look at walls and get measurements of where there's higher level readings, and find the problem and the source of the problem to address where it's coming from, so that they can not only remediate the mold but fix the problem of what caused it in the first place, just like we want to do with you, root cause. So environmental treatment. Now, next step, you need to get a mold company to remediate the mold, and that is not always the same as the inspector. So you want someone who knows what they're doing to actually clean the mold out, and those are various ways to do that. It can be through chemical compounds and bombing of a house. It can be through enzymatic approaches. It might have to do some remodeling and some remediation with the actual construction, depending on how severe it is or where it's located. Sometimes that means pouring cement in the basement because there's a loose floor, and so having a company in there to actually fix the problem and remediate the mold is important. Now, on top of that, we need to remediate the household items. That's clothes, that's mattresses, that's whatever we can to actually clean out the problem. So you can use specialty solutions. I recommend them here. But cleaning out what was affected with the mold, because that can prolong the symptoms and perpetuate the problem if you're still being exposed, because all those spores are still trapped in fabrics, in clothes, on the floor. Cleaning the house, dust everywhere can hold mold. So air filters are huge. Oil diffusers can help, but there's a lot of ways to approach the problem, but remediating it is the most prioritized strategy. In the meantime, getting the HEPA air filters in there, opening the windows, making sure that there's ventilation, those are all good things to do in the meantime. And then, how do we treat you? Now, this is a very complicated portion of the equation that you need to work with someone who's trained to do this process. It's very hard to do on your own, and everyone's got a different approach, right? So in simple version, and I think this would apply to most people's strategies, is that you have to stop the exposure, number one, because if you're still ingesting, inhaling, and absorbing those toxins, you're still going to have symptoms regardless of what treatment strategies you implement. You're always going to have more coming in as you're trying to get rid of it. Number two, I always want to support the body and the physiology of the body, because one, that'll make the person feel better, but two, it will make the body function better to eliminate those infections and to eliminate those toxins. So support the body and the physiology, and that's simple. That's like diet, hydration, and sleep, and nutrients, and vitamin support, basic stuff to get the body working properly. Once that's started, that process is started, you start draining and binding the toxins out of the body. So a lot of people use binders of some sort, like charcoal and chlorella and cholestyramine and NaC and bentonite clay and humic acid and fumic acid and all these different types of binders to grab those toxins and discard them out of the system. And then you also need to support the lymphatic system as well, support the liver. You're trying to drain those toxins out of the body, but you also need something to bind them and discard them. So there's a complicated process of that. And once your body's getting rid of things, you can start going upstream and start making sure everything's flowing correctly from the cells out, from the liver out, so that the body's moving all of its drainage pathways out of the body. And there's a lot of different strategies for that, both from activity standpoint, like saunas and castrol packs and hydrotherapies and all these different strategies, lymphatic massage, but also from a nutrient and supplement and lifestyle standpoint too. You can take things to help that process. Once your body is functioning better and there's no more toxins, or there's less toxins causing problems, where you're getting better function in the body, you can start working on your infections, whether that's a sinus related congestion infection or a gut related infection, or even co-infections like Lyme disease or chronic related viral infections, things like that, which are stagnant and ongoing due to this amount of dysfunction in the body from those toxins. Then you start treating those things, they go away pretty easily, because the body's not functioning the way it should to handle them. So, lots of information in a short period of time, but this is your cheat sheet to kind of get started, and hopefully it helps and makes sense. But always have someone on board to help you through the process of identifying, remediating, and treating the exposure.